Hello, my name is Dr. Vidya Mystery, and I'll be presenting today with two of my Year 5 students, Ali and Mohammed. I am a GP and clinical lecturer at QMUL, and I'm going to be talking about a project that I have been doing at the medical school. And the title of my presentation is Undergraduate Near-Peer Teaching in Primary Care, Experience of Students, Near-Peer Teachers and GP Tutors. This is the abstract, which shows that, as I said before, there is very little research relating to undergraduate near-peer education in primary care. However, postgraduate literature suggests there are potential benefits, which include increased teaching capacity and showing general practice as a potential career for medical students. So following a pilot at the practice, a new SSC, student selected component, was developed where Year 5 students are teaching junior students at the practice, as well as working with central academics to help them to apply for a university student engagement award. Right. There was also research done for this as part of my master's. So qualitative research methods were used, including semi-structured interviews and focus groups. The preliminary data from this research suggests improved student-teacher confidence with evidence of collaboration and creativity. There were numerous teaching opportunities in the practice. So finally, near-peer teaching appears to work for both students and tutors in primary care. Students had clinical and teaching experience, and GP tutors welcome the near-peer educator enthusiasm, innovation, and help with the teaching. And these preliminary findings, contribute to the growing evidence for the value of peer-assisted learning in undergraduate teaching. Is that okay? Background and context. I am a GP and clinical lecturer in Northeast London. I work in a fairly large teaching practice of about 10,000 patients. The practice also is involved in postgraduate teaching. We have 4 GP tutors. The idea for this near-peer pilot came about with the overlap of students at the practice. For example, Year 3 students and Year 5 students were attending the practice at the same time, but there was no real interaction or collaboration. There is also a large existing body of literature on peer-assisted learning. This suggests that if students are involved in near-peer teaching, which is senior students teaching younger year students in an undergraduate context, students who are involved in this near-peer teaching can be better teachers, better doctors, and better learners. At the moment at our university, there are very few opportunities for senior students to get involved or in near-peer teaching, or very few formal opportunities. There is one program called DATE, which is Doctors as Teachers and Educators, but this is really the only formal opportunity in the final year. Therefore, this near-peer SSE is something that gives students the opportunity to participate in near-peer teaching at an undergraduate level. Currently, we have nearly completed our first elective, as well as the pilot SSEs. with high levels of student engagement and positive feedback. We've had 6 students who've been placed in 3 different practices with a placement between 4 to 6 weeks. The near-peer teaching placement has been based in primary care, but the students have also attended central workshops and forums on medical education, as well as collaborating with central CBME academics. We have encouraged them to work collaboratively with each other, and they have over the placements they have developed their teaching portfolios, which has included development of student and tutor guides, mock OSCEs, exam writing questions, and they have been, as part of their assessment, they have applied for the Cumuel Seed Award, which is a student engagement award. This slide is looking at the gap in the literature. As mentioned before, there are few formal undergraduate near-peer teaching examples in primary care found in the literature. There are lots of examples of peer-assisted learning in a clinical skills or other central teaching contexts. Looking at the postgraduate literature, there is some literature on GP registrars teaching medical students in a near-peer or peer-assisted context. This literature has shown that the benefits can include consolidation of knowledge and skills, promotion of general practice as a career, and increased teaching capacity. The challenges are lack of opportunities for teachings and lack of promotion by key stakeholders. The preliminary findings from my research suggest that some of the benefits that have been shown in postgraduate literature, for example, increased teaching capacity, can also seem to be beneficial in an undergraduate context as well.
Hello, my name is Mohammed Anisalavi, a final year student at Barts, and I'll be talking with my colleague Ali Sahel about our experiences doing this near-peer elective.
So one of the main reasons why I wanted to do this elective is because it gave me a chance to formally teach some younger students, and I haven't had this chance of formal teaching prior to this really. So it allows me to enhance my teaching skills and refine my teaching skills, and I really look forward to positively contributing to how the GP3 curriculum develops, and also applying for the SEED award, which is an engagement award, was a real pull factor for myself and for other students, because it's something that will benefit us in our careers, for the future when applying for medical education roles. So at the start of our 6 weeks, we conducted a learning needs assessment via small group discussions with our third year students. And from this, it was really clear that there's been a lack of support and communication between older years and younger years, particularly enhanced by COVID-19. Therefore, we were able to discuss with them how best to approach the year, as well as talking about which resources to use for exams and for OSCEs. And based on where they felt their holes in knowledge were, we then formed a 6-week timetable with a theme for each week, as you can see on this slide here. We've also been able to edit the GP3 website to include some of our resources that we hope future GP tutors and students will benefit from.
Hi, my name is Ali Sahel, a 5th year medical student on the near-peer elective. Through this elective, we learnt that an educator needs to adapt their methods to different circumstances and always polish their skill set to enhance their teaching and keep students engaged. Through weekly central teaching sessions, we were permitted to have an appreciation of the literature. For example, we learnt different feedback models, such as the sandwich and reflective feedback conversation models, and how they all had a part to play in different situations. Through this teaching, we learned the use of technology and how important it has become due to the pandemic and how it should be employed to deliver the best teaching experience. Open discussions with senior educators let us practice different models and allowed us to reflect on our week's teaching. This altogether let us plan better for the future weeks. Continuous patient exposure with our supervisor allowed us to keep our clinical knowledge up to date and feel more confident as senior students and educators. Overall, all the teaching given to us centrally and in person let us improve our teaching and incorporate new ideas which were well received by the students.
There weren't many challenges during this elective because for the most part it was really enjoyable, and I do feel it's really benefited myself, the GP tutors and the students, but there was a lot of work involved, especially to prepare lessons to make sure that they run as smoothly as possible. I think the biggest challenge going forward is to make sure that near-peer teaching is widely accessible to all third-year students, and the best way that I think we can do this is by synchronizing the fifth year and third year GP calendars so that they'll be on placement at the same time, and this will give opportunities for fifth years to act as near-peer teachers and for third year students to benefit from them. But again, I think it's a logistical challenge more than anything, which I hope the medical school can sort out for the future, because it really is a good elective, and third year students have given really positive feedback for this near-peer teaching.
On this page, we can see quotes from the students whom we taught over the course of the elective. These quotes describe what they thought of the near-peer elective. The quotes provide us with a great opportunity to get feedback and reflect on our teaching.
So common themes in students' feedback included how they feel more comfortable around near-peer students compared to GP tutors, and this is possibly due to the large education and age gap between GP tutors and themselves, and this generally has led to them feeling more open around us, allowing them to ask more inquisitive questions and feel less judged when contributing to the learning space. The small group sizes have also allowed for opportunities of one-to-one teaching, which is something that students really appreciated, as they haven't really had much of this during medical school. On the whole, students do feel that this elective has made a greatly positive difference to their learning, and it's something that they recommend to their peers.
As you have seen throughout this presentation, this project has allowed us to bridge the gap which was created due to COVID-19, thus permitting us to convey our knowledge gained through our own experiences and deliver them to junior peers. This experience also improved our teaching skills and let us appreciate the literature and put what we learned into practice. Through focus groups and anonymous feedback forms, the near-peer elective teaching has been well received by the students that we have taught, which is encouraging. Most importantly, this elective has set up another pathway for future medical educators presently in education to enhance the teaching skill set when their time comes. The only recommendation we have for this project is that we wholeheartedly believe this elective should carry on for the future, as it provides an avenue for young educators such as ourselves to learn a lot about teaching and appreciate the medical educator's role.